Hey guys, it's Sarah here. In this video, I'm going to be going over what no one tells you in nurse practitioner school.
I think this is very important for anyone to hear if they plan on going for their nurse practitioner degree or if they're in nurse practitioner school. So let's get started. So number one, the first thing I want to say is that most of the programs are self-teaching. Even if you have instructors, etc., they're self-teaching. Professors will link to YouTube links, they'll link to the guidelines that you have to read. The guidelines, some of them could be like pages long, like the diabetic guidelines, like 40 pages long you have to read. So a lot of it is like self-teaching. This is why experience is so crucial. You're learning everything yourself from the books and taking what you see in practice and putting them both together. That's my first point. Number two is finding your own preceptor. This is a big thing. It sounds like, oh, I could follow this doctor, I could follow this nurse practitioner, but it's not that easy. First of all, a lot of doctors have their own residents. Second of all, a lot of nurse practitioners are under institutions or doctors and they don't allow them to have it. So even if your neighbor would be like, it's fine with me, but the doctor over her may say no, or the practice as a whole may say no. So it's very hard to find your own preceptor, and especially someone within travel distance. And even the schools that say they're going to help you, they don't. They really don't. And them helping you is like finding someone in your state. Now, I don't know what state you come from, but for me to travel in my state, anywhere they put me, that could be 4-hour travel. You know what I mean? So it's a little crazy, and they barely help you. So basically, you're finding your own preceptors. And if you don't, you have to push over the semester, and there's only a certain amount of semesters you're able to skip in a program. So it's very stressful, and it's something you want to think about beforehand. Number 4 or 3 is pay cut. Everyone's like, oh, you go from nurse to nurse practitioner, and you make a lot of money. So it really depends, your state and how much you're making now and how much experience you have as a nurse. But a lot of people take a big pay cut when they go from nurse to nurse practitioner. So if you're doing this for the money, then don't do it. Number 4 is you want to factor in time, money, and just stress. So usually in this period of time when someone's going for the nurse practitioner, they have a family, they're working full-time, and they need to work to pay their bills. So you want to factor this all in when you're going for nurse practitioner school. You're going to add however much time you have now before you go into nurse practitioner school, and take that completely away. It's very stressful. You have less time with your kids. You have no time to vacation, to go out to eat, etc. So that's the difference between when you were a nurse, you probably weren't working full time and you weren't doing like shifts and, like stuff like that. And you probably didn't have a family. So this is just more stressful, more time consuming, and harder that way. Number 5 is that people are like, oh, nurse practitioner, you're going to be a doctor. You're not going to be a doctor. Doctors have years of experience in medical school. They are far more knowledgeable. And a lot of patients, you should just know, some patients don't want to see nurse practitioners. They'll be like, I want to see the doctor when you come in. So that could be hurtful because you could be like, I'm going for a nurse practitioner and I'm going to be a nurse practitioner. But just know, I've seen people love nurse practitioners and request nurse practitioners because they feel like they could talk to them and they're more available. But I've seen people say, I only want to talk to the doctor and you don't know what you're talking about and stuff like that. So it goes both ways, and just know you're not a doctor or anything like that. You're a nurse practitioner. You're an advanced practice nurse. So basically, my final thing is that with all these stuff, so including like the self-teaching, the finding your preceptor, the pay cut you may take, the stress you may take on, the amount of money, and also factor in that the amount of money it costs, you might have to pay to find a preceptor. So that's even more money per clinicals and stuff like that. So really, I'm really not discouraging you from becoming a nurse practitioner. I am very happy myself, but I'm going into this to diagnose and treat a patient. I'm not going into this for the pay increase. I'm not going into this for like, because I'm a nurse practitioner now. I'm going into this because this is what I want to do in my career. I want to diagnose and treat patients. So if that is your goal, then that's good and go for it. But if you're going to go in thinking like anything, like I said before, like you get a better title or pay increase, that is a lot of times not true, especially it depends what you do as a nurse. If you're a travel nurse, if you have years of experience, that's really not true. So I just want to let you know that, and you should think about all these stuff before you go into school. And if you have any other questions, please put it in the comment section or message me, and like and subscribe.